Thank God for the gift of life. Today, we discuss microbial resistance to antibiotics. I had a rare opportunity to meet young doctors, precisely pharmacists. They will help us unpack this very important topic. Subscribe, and together, let's push back the tide of disease in our world. Maybe weekly podcasts. We discuss health for everyday life, pushing back the tide of disease in our world. For health is by choice, not by chance. Dr. Augustine, pharmacist intern. Dr. Felicia, pharmacist intern. And Dr. Lamarck, a pharmacist too.
That is, let's say, we call it antimicrobial resistance. In short, we abbreviate it as AAMR,
Mm-hmm.
and it's a current and endemic, in especially in this world. And we in short time, it refers to misuse and underdosage of medications.
Thank you very much. Maybe what are the common causes that causes microbial microbial resistance in our setting or any other place maybe?
Mm. Okay, so the common causes of antimicrobial resistance normally come with the interaction of a patient with the medication. That is the first step where
Mm-hmm.
we get the resistance.
Yeah.
So the causes are wrong prescription.
Mm-hmm.
That is, you find that some patients use all prescription that is maybe from their friends or
Mm-hmm.
from their kin, and they indicate it for themselves without visiting qualified practitioners who
Uh-huh.
can make a diagnosis.
Mm-hmm.
Then another common cause in wrong prescription is sharing medication with the
Mm-hmm.
family.
Mm-hmm.
This normally occurs in the public. I'm sure some of you have shared medication in the course of your life.
Mm-hmm.
So another common cause is not completing the drugs that you've been given,
Okay.
purposely antibiotics.
All right.
So you find that most antibiotics are given for a given course of duration of time,
Uh-huh.
maybe 7 days, some even 14 days, some
Mm-hmm.
even a month, depending on the condition and the severity.
Mm-hmm.
So some patients, when they feel better, they don't complete
The cause.
the course of the medication.
All
So
right.
yes, so this may bring about the microbes to resist the drugs.
Mm-hmm.
Another one that maybe most of us may not have come across is agricultural use, but is a common one too.
Mm-hmm.
You find that we use the same antibiotics in humans and animals. So some of us have pets,
Yeah.
some of us rear domestic animals like chicken,
Mm-hmm.
which is common. They give the medication to the chicken and they take the food with the microbes that have undergone the resistance. This may cause the introduction of these microbes to ourselves
Mm-hmm.
and bring about the resistance. And then the last one, but not least, poor infection control.
We've studied the prevention ways upon which we can be able to prevent against this microbial resistance in the society. Maybe you can highlight that to the public.
As my colleague has said, the for the wrong prescription, the public, you should make sure that you don't self-medicate. Make sure you visit the hospital or seek medical attention from a qualified medical person so that
Mm-hmm.
you don't get just drugs from your kin or your friends. Just because you have the same symptom doesn't mean you are sick from the same disease.
Mm-hmm.
So just make sure you get your own prescription from a qualified personnel. And then in the course of poor prevention,
Mm-hmm.
like first of all, uh, your immunity plays a big role in disease.
Uh-huh.
Yeah.
Uh-huh.
So make sure you build your immunity. ways you can do this is through eating adequate fruits, vegetables, exercise. Exercise always plays a role. What else? Yeah.
In terms of our nutrition,
Mm.
then we need to exercise. Very important health principles that will like build our immunity so that it can fight back any attempt of microbes gaining access to the system. Daktari, you've been very quiet. Do you think there are any other ways that we can use to build our immunity and ensure that we are able to prevent disease maybe for our audience?
One thing I can maybe can go back in time.
Yes.
Just look at during coronavirus. We as a nation,
Yeah.
we took upon ourselves to prevent corona.
Oh, sure.
And one of the best practices was ant cleaning, observing proper diet, visiting health centers in case we have an issue.
We are sick, exactly.
So I think we should also remind ourselves we treat every illness as endemic.
Oh yeah.
And so that we can try as much as possible to prevent their occurrence. Yeah, that's what I can add. Yeah, my colleague has mentioned most of them.
Most of them.
Yeah, but I hope we have impacted you in the best way possible.